Hello everyone, welcome to my YouTube channel, What's Trending with Casey. On this episode, we'll be discussing what causes period pains in women. A lot of women experience very painful periods during that time of the month. This is Dr. Mujajati Aaron, a well-known Zambian medical doctor. Let's find out more on what causes a woman to have very painful period pains. Let's watch this.
Good morning, ladies and gentlemen. I hope we have some men who have decided to join us in this very important discussion. I think men also need to take interest in such subjects. Ladies, one of you asked me or asked us or asked the page to discuss the issue relating to painful periods. Now, you will appreciate that in women, every month, you will find that the uterus prepares for pregnancy every month. It's natural. That's what it does. So every month, your uterus prepares itself to get pregnant. When the pregnancy does not happen, whatever preparation your uterus had made, it will get rid of it. So the way your uterus prepares itself for pregnancy is that it will layer a lining inside itself. It will put a lining inside itself, and that lining tissue is driven by hormonal changes. So you have all these hormones that are flowing all over to try and prepare your body for pregnancy. So every month, a woman's body prepares itself to get pregnant. Now, when the pregnancy does not happen, the uterus would have to go back to what it was. So it means that it has to remove everything it had prepared itself for. So that's the shedding that happens, and that's why the bleeding happens when you're having your periods. Now, when you're having periods, cramping and pain is expected. It is normal. It is expected. But when the pain becomes so bad that you miss work, it becomes so bad that you miss school, it becomes so bad that you can't get out of bed, you can't do any activity, that type of pain is what we are discussing today. That is not normal. It's very, very abnormal. To have period pains that disrupt your life, or period pains that stop you from being active or doing what you want to do. That type of period pain in medical language is called dysmenorrhea. And there are basically two types. In medical language, there are two types. There is what we call primary dysmenorrhea, and there's also what we call secondary dysmenorrhea. And both of them, the causes are different, and we'll run through them very quickly, and then we'll also conclude with treatment options. Dysmenorrhea, when it's primary, this is where you have that excruciating pain from the beginning. Like from the date you started your periods, you just experience this excruciating pain. And usually primary dysmenorrhea, the way it happens is that you will have pain before the periods start, during the periods, and it will stop after you stop the periods. Whereas secondary dysmenorrhea, this is where somebody was having normal periods, okay? And then later on in life, they are having these periods from the pit of hell. These periods that just want to kill you. That is called secondary dysmenorrhea, or secondary dysmenorrhea. It's called secondary because you were having normal periods before with the normal type of pain that everyone has, and then suddenly you start having these very, very painful periods. We'll discuss the causes as well. So now, you will find that that pain comes from the fact that there's a special hormone that gets produced that allows for the muscles to contract, because you see the uterus needs to contract as it is getting rid of the layer that it had put together as it was preparing to get pregnant. So you produce a group of hormones called prostaglandins. Forget about the medical language. Just remember that there's a hormone that you produce that is also helpful in the uterus to contract. Now, it is that hormone, when it is helping the muscles of the uterus to contract, it also induces inflammation, and that's what produces the pain. And it can be bad in some people. Now, there are some people who are born with the risk for very painful periods. For some, you find that you inherit this problem from your relatives. So if you ask your relatives, your mother, your aunties, you'll find that someone in your line of families also have the same problem of very painful periods, because some problems run in families. Women who smoke have very painful periods usually. That's another cause. The other one is if you started your periods very early, okay? If your period started very early, or you attend puberty very early, if you started periods, say, around the age of 11, 12 or less, usually you will have very painful periods through and through. And also you will find that most people who have very, very painful periods will also tell you that they experience heavy bleeding. So if you're having heavy bleeding, chances are you also probably have very, very painful periods. The other risk is where people have irregular periods. Your periods are not very regular. You cannot predict them. They sometimes come to day 28, some exceed, some early, some late. So people who have very, very irregular periods, they also experience excruciating, very painful periods. Now, there are those whereby you were having normal periods, and then along the way, you start experiencing extremely painful periods. That one, usually you will find that it's people who have fibroids. So if you have fibroids, you will notice that your periods are extremely painful. The other group of people, it is people who have a disease condition called endometriosis. Endometriosis is a disease condition where, remember that lining I talked about in the uterus when the uterus is preparing itself to get pregnant? That lining can also abnormally find its way in the tubes. It can find its way in your ovaries, or it can grow anywhere else in the abdomen. Okay. Now, if it grows in other parts of the body other than the uterus itself, inside the uterus, it behaves as though it is in the uterus itself. And endometriosis is extremely, extremely painful. Extremely painful. The other condition is PID. We call that PID. PID basically stands for pelvic inflammatory disease. This is a sexually transmitted disease. It's bacterial, and it affects the uterus, the tubes, your fallopian tubes, and people who've had this problem also experience very, very, very painful periods. Another cause that is very important is a disease condition called adenomyosis. Adenomyosis, remember I talked about endometriosis. Okay? This is where the lining of the uterus is growing in other parts of the body other than the uterus. Now, adenomyosis, it is where the lining of the uterus is growing inside the muscle of the uterus itself. And because it is growing inside the muscle of the uterus itself, it causes excruciating pain when the uterus is contracting. And you know the pain. Those of you who've gone through this, you know the pain. Now, when you notice that my pain or the uterus, the pain that I get when I'm having these periods has changed, for example, you know you are having this normal pain, and then suddenly you discover that your pain has changed. The other cause I forgot as well that is very important is that you'll find that ladies who've never been pregnant usually have very, 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 very painful periods. Ladies who've never been pregnant very painful periods. Extreme. That's another cause. Now, what should you do if you are now realizing that, okay, for me, this pain that I get, it behaves like, it's a demon in itself. You need to see your doctor, your obstetrician, your gynecologist near you, wherever you are. Okay? If you don't have a gynecologist where you are, you can see us or you can see anybody near you. They need to do some investigations, which will include a scan. They will scan you. They will put you down and scan you. They may do some blood tests depending. Okay? But you need to see a gynecologist. A gynecologist. That's what you need to see. Then they will advise you to do some things, but there are some things you can do at home that can also help with the pain. Some ladies have experienced this. They will tell you that if you take a hot water bottle and put it on your tummy, it tends to lower the pain a bit. Those are things you can do from home. The other thing you can do from home is you can take a warm shower. Some ladies have reported that if they take a hot shower or a warm shower, it tends to lessen the pain a bit. So there's no harm in you doing that. Okay? Others have said, okay, I use some relaxation techniques that help me, breathing techniques that help me. So we've seen all those. But the mainstay of treatment for excruciating periods is that they will put you on painkillers. These Panadols, if Panadol doesn't work for you, they'll put you on Brufen. If Brufen doesn't work, they'll put you on Brustan. If Brustan doesn't work, they'll put you on Valas, Diclofenac, and the list goes on until they find what helps with the pain. All right? Then, there's another condition I forgot to mention earlier, which also presents with very painful periods. It's called the premenstrual syndrome, PMS. All right? I won't talk much about it, but let's continue talking about the treatment. I forgot to talk about premenstrual syndrome. I don't know why. But just bear in mind, put it on your list of causes, premenstrual syndrome. So, they'll put you on painkillers. Now, some treatment modalities depend on the cause. For example, if you have secondary dysmenorrhea and the cause is fibroids, then the fibroids need to be treated. They need to be removed. Otherwise, the pain will continue. You'll continue to suffer. So it means those fibroids need to be removed. All right? Now, where you find that surgery is not helping, they tried to remove the fibroids, or they tried everything. One of the last resort, final resort, if everything else fails to manage your pain, they will remove the uterus. And some women have opted to have the uterus removed in order to relieve themselves of the pain. I don't know what you're experiencing. For you to be here, you may have experienced this, or at least you know someone who has. Let them seek help. All right? Of course, the list I've given you is not conclusive. All right? The list I have given you of the causes is not conclusive. Maybe for some of you, your cause is different, and for others, the cause is different. So this is what we will.
I hope you have learned something on what causes very painful period pains. And if you are suffering from very painful period pains, seek medical advice, just as the doctor has said. Don't forget to subscribe to my YouTube channel, and thank you for watching.